Hello lovely OTs, it's your girl Nancy and I am back with another video. Let's get into it. So today I'm going to talk about a topic that is very serious and also very important. I used to get patients with this diagnosis here and there, but recently I'm getting a lot more and more patients with ethanol alcohol diagnosis, and sometimes these patients come to me with just that diagnosis, or they will also have liver cirrhosis diagnosis, as well as like fractures diagnosis accompanying that. So I wanted to talk about this because I feel like, okay, obviously if there's a lot more patients being admitted with this diagnosis, then maybe we need to have a talk about the effects of alcoholism and how it can affect your whole life, your whole body. What is ethanol? Okay, so ethanol is basically the chemical in alcohol, and ethanol, what it does is that it makes you feel good, right? So when you have a drink or two and you start feeling tipsy, or you start feeling like you don't know what's going on, you even lose your memory sometimes and people don't remember what happened when they were drunk. This is because the chemical ethanol in alcohol impacts your brain ability to remember things that are happening. It impacts your balance, and that's why people cannot walk straight and they're falling all over the place. Alcohol poisoning is something that's also popular with getting drunk. You start to throw up and your stomach cannot handle the amount of ethanol in your system because it's a chemical in your body that's not supposed to be there, so your body may eject it by you throwing up. So I just wanted to say that because I want you guys to think that when you get drunk and you start feeling those different symptoms, is what I'll call them, it's not normal. It's not something that we should glorify, because it's a way of your body telling you that there's something wrong. There's nothing wrong with drinking as long as you know your limit and as long as you know what your body can handle and what your body cannot handle. Also, the problem here to keep note of is not the fact that you're drinking alcohol, is the fact that you are dependent on the chemical. Yes, alcohol is a drug, okay? And the ethanol in the alcohol is a chemical. So you don't want your body to get dependent on this drug or this chemical, because it's going to have long-term effects on your body. Now, what can be affected? The number one thing that I see with my patients with ethanol diagnosis is liver damage. Liver ascites is something that I also see with my patients, which basically means that the liver is not functioning any longer. There's liver damage in the body. Your liver has been damaged to the point where you are retaining fluid. Sometimes you retain fluid in your abdomen, you retain fluid in your legs, your arms, for example. So there's fluid retention going on in your body, and this is not good. Your body is supposed to be able to distribute fluid all throughout your body, or get rid of fluid. And if your body is not being able to do this because your liver is damaged, and it's a problem. And patients with this diagnosis usually have to go to the hospital like every few days to get it drained, because it's so painful and it's so uncomfortable. And on top of that, it also affects your ability to breathe properly. So your liver has over 50 functions in the body, including helping you remain healthy, getting rid of germs, getting rid of things that your body does not need, toxins that your body does not need. So your liver is so important, and we must take care of it. Now, the thing that also troubles me is that when your liver is on the verge of being damaged, and also remember, if your liver does damage, it doesn't reverse. There's no way to reverse it once it gets damaged. You have to get a liver transplant. You have to get another liver, or you can die from liver damage. So there's no symptoms sometimes when it's scarring. Usually you start to get symptoms if your belly starts swelling, for example. You may see physically that there's something wrong, and most of the time it doesn't give you like an alert, or you don't know that there's something wrong until it's too late. So just to make sure you can get checkups with your physician like every year to make sure that if you are someone who drinks occasionally or drinks more than you should check with your doctor to make sure that your liver is in good condition, because you don't want to get to that far end where you have to get another liver or you can die from damaged liver. Other parts of your body that can get affected is your brain. So like I already mentioned, when you get drunk, you start to forget things, right? You start to lose your balance. You're able to keep balance because of our brain. And the part of our brain called our cerebellum is what controls our balance. And also a part of your brain called the hippocampus is what controls the memory. So when you don't remember things, these are all parts and functions of the brain that's being affected by the chemical in alcohol. So there are patients who have actually, like I already mentioned, who come in with an alcohol diagnosis that also have dementia related symptoms as well. Even though they're not drinking anymore, it's almost like they have drunken themselves to the point where they have damaged part of their brain, which is responsible for like safety and for like behaviors and for like memory. Like the alcohol have permanently damaged that part of the brain, and I see it all the times in my patients. Another thing that can be affected when you drink too much is definitely you are going to have high blood pressure issues. When you have high blood pressure, you can also get a stroke, so you want to refrain from it as much as possible. Not only can you get a stroke from having high blood pressure, you can also get heart attacks from having high blood pressure. So keep those two things in mind as well. Another thing too to keep in mind is that alcohol can also affect your insulin level in your body, which can also cause you to get diabetes. So you don't want that. You don't want to get diabetes, to be diagnosed with diabetes and be dependent on insulin because you are drinking too much alcohol. So another thing that I see a lot with my patients who have alcohol diagnosis is also falls. Like I mentioned, a lot of them end up getting drunk, falling and breaking a hip, breaking a wrist, breaking something, having TBIs from getting drunk and falling on their head. So it's not something to be played with. I've seen some really bad fractures from patients who have to be in a rehab for a very long time because they were drinking too much and had a fall. Other things that can be affected: you can get cancer from too much alcohol. You can get intestinal and digestive issues from drinking too much alcohol. Usually, like alcohol poisoning can put someone into coma. Drinking too much alcohol can put you in coma. And you can die from drinking too much. You can die from drinking too much, and you can die from getting liver damage from drinking too much, which can essentially kill you. Liver damage can kill you. So it's like a secondary thing that can happen from drinking alcohol. I'm going to tell you guys what I do with my patients with the Etoh diagnosis. So I work with memory, cognition, because a lot of them have memory problems, you know, safety problems, altered mental status, where they don't know where they are, they don't know the month, they don't know anything that's going on with them. The orientation is like ×1 sometimes, so, or they don't even have any orientation sometimes. So I work on their memory and their thinking and safety and all of that in conjunction with when they're doing their self-care. So I connect it in that way. Another thing that I work on with them is the obvious one: strength building. Some of them are weak because they've been in a hospital from like withdrawal and being so deconditioned. Sometimes when you're drunk, you can't do much, right? So a lot of them are very weak, very deconditioned. So I work on strengthening exercises with them to build up their strength again. I work on endurance training with them. Like I already mentioned, I've noticed some shortness of breath, not being able to tolerate activity. So I work on building the endurance up again with the patient so they can be able to engage in their activities that they want to be able to engage. Safe functional mobility is another thing that I work on with them, for them to be able to safely go from one place to the other without falling. So fall prevention, fall safety. So fall prevention, safety with moving around, safety functional mobility, safety with transfers and things like that. I work on that with them as well. I also work on them being able to do their own self-care by themselves, right? Increase that self-care independence. That's a goal that I always write for my patients, to make sure that they'll be able to take a shower and dress themselves since they're being affected by memory and their cognition is affected. I want to make sure that they're able to take care of themselves as much as they can, as independent as possible. I also do a lot of education, so educating them about the effects of alcohol, educating them about different lifestyle choices, you know, making the right decision, changing their diet, changing their lifestyle, especially if they've been diagnosed with liver cirrhosis. They need to change their diet, they need to change their lifestyle so that they can be alive for as long as possible, because once you are diagnosed with liver damage, most of the time don't have a good prognosis. Most of the patients end up dying and passing away, especially if they are still drinking and they are not watching what they're putting in their body and things like that. So a lot of education is what I do with them. Obviously, the obvious one is to recommend that the patient get some alcohol rehab. Okay, so outside of my rehab that I'm giving them, they can also go to like a AA meetings. I think that's what they call them, the AA meetings, where they can get even more assistance and join in a group that's basically going to be helping them to attain, you know, different skills that will allow them to be on top of their habits, their drinking habits. So also, guys, you have to remember, this is not a place of judgment. I love to educate people about what's going on, because a lot of people don't know the effects of the different things that we put in our body. So this channel is really here to help you guys see the effects and the things that I see personally in the nursing homes and in therapy, the diagnosis that I come across a lot, and how you can prevent it from happening to you or to a family member. And so this channel is to provide information and to help you guys to become as safe and as healthy as possible, because health promotion is part of my job as an OT, to prevent certain things from happening in the first place, right? So pre-habilitation, habilitation, and post-habilitation. All right, so that is the end of my video. If you guys enjoyed it, please go ahead and thumbs up, send me an email, make sure that you like, subscribe, make sure that you like, comment, and subscribe, and I will see you guys in the next video. Bye.